Knock, knock, knock. How you doing there?
Good.
My name's Nicole. I'm just going to be your nurse today, and I hear that you're getting discharged, so that's really good. I'm excited to hear that. I'm just going to do a quick head-to-toe assessment. But before we get started, can I have you verify your name and date of birth for me, please?
Jane Smith, September 13th, 1999.
Okay, great. That's exactly what I have in my record. So, right now would be a really good time to do subjective data collection on my patient, but since we already did that with our head-to-toe assessment, I'm going to defer that right now. But just upon walking into my patient's room, I'm already looking at a lot of things, the general survey of my patient. I'm looking at her overall skin color, I'm looking at her posture, how is she sitting in the bed, I'm looking at her build. I'm already starting to assess her mental status. How are her thought processes as she's talking to me? I'm looking at her eye contact. Is she making eye contact with me? So I'm reading and assessing a lot of these things already just upon walking into my patient's room, just looking at her overall general appearance. Another thing I did before I came into the room was I checked my patient's height and weight, her BMI, and her vital signs just to see how all those look, and her recent vital signs, making sure they're all within normal ranges. Jane, are you in any pain right now?
No.
No? Okay, so on a scale from 0 to 10, you'd rate that at a 0?
Yeah.
Great. So just like I mentioned, I'm going to go through, I'm going to kind of poke and prod a little bit. I'm going to listen to your heart, your lungs. I'm going to look at your legs, everything. Before you go home today, I just want to make sure that everything is good to go, that I don't see any concerns. Okay. Do you have any questions about anything?
No.
No? Okay. So with the head-to-toe assessment, right away I would start at my patient's head, but because we did a very detailed head, face, and neck assessment, I'm going to defer that right now. But if this were a typical head-to-toe, I would start with the head and work my way through those different systems as well. So I'm going to skip right to my eyes, and the first thing I'm going to do is I'm going to check my patient's perla, and I'm just looking at the pupils and making sure that they're equal and round and reactive to light and accommodation. Without moving your head, can you just follow this with your eyes? Very good. And when I do that, I'm looking at the pupils, making sure that they constrict equally. I'm also looking at the external structure of my patient's eyes, looking to see if I see any swelling, lesions, bumps. I'm looking at the color of her sclera, making sure it's nice and white. Always looking at the symmetry to see if they're nice and symmetrical where they sit on the skull. And then I'm just going to work my way over to all the other structures, looking for the same thing, looking for any abnormalities, looking for bumps, bruises, lesions. So I'm just going to kind of look at your ears here, looking for the same things. I'm just going to kind of palpate them a little bit. Any pain when I do that?
No.
Okay, good. And then if you wouldn't mind, can you just pull down your mask for just a second? I want to take a look at your nose. And again, I'm looking at the symmetry, looking at the color of her overall face, looking at her nose and her lips at the same time to see if I see any lesions, any breaking of the skin. Also, I want to just make sure that you can breathe in and out of your nose just fine. Would you mind just plugging one nostril and breathing in? And then how about the other side? Any problems when you do that?
No.
Okay. And then I want to take a look inside of your mouth, if you wouldn't mind opening wide. I'm looking at the buccal mucosa, and while I'm here, I'm just going to take a look in those nares too, because those are nice mucous membranes that should be nice and moist, so I'm looking to make sure that everything's nice and moist. I'm looking at the teeth, the hygiene of her teeth. I'm looking at the tongue. Can you go ahead and stick your tongue out for me and go to the side with your tongue? Oh, yeah, there you go, just like that. Sorry, I wasn't very clear in my instruction. There you go, and then lift it up. Okay. Taking a good look at all of that, the gums, the teeth, also the hygiene of her teeth reminded me that when I walk in, I'm also looking at her hygiene as well too. So when you're working through your final, if something triggers you like, oh yeah, I forgot to mention that before, it's okay to throw it in there at any time. As long as you do it before you walk out the door, I don't care when you do it. So you're gonna notice that you're not necessarily gonna go in the perfect sequence as it's listed for you in the checklist I made for you. Totally okay, as long as you hit it. And even if you need to take a time to pause, like, okay, did I get everything? Totally fine, okay? So again, once I walked in, I'm also looking at my patient's hygiene, her dress, her groom. Is she able to do those activities of daily living? I'm taking note of all of that, okay? And so typically, you can go ahead and relax your head. I would work my way down, and I would go into the neck right now, but because we already did the neck in detail, we're gonna defer that part right now. And I wanna go right into my thorax and my lungs. So at this point, in a real hospital setting, I would expose my patient's skin. And I would do all of my inspection, my auscultation, my palpation directly on my patient's skin. But for the purpose of the final, you can just verbalize this point and just say, in a real scenario, real life setting, I would expose my patient's skin and listen and look on the bare skin, but for the purposes of this test, I'm just gonna do it over my partner's shirt, and that's okay. So with my patient's bare chest exposed, I'm looking at my patient's thorax, I'm looking at the color of the skin. Is it appropriate for ethnicity? You're always touching too, so what's my patient's temperature? It should be nice and warm. I'm looking for any obvious abnormalities, deformities, lesions, bumps, anything like that that kind of stands out to me, bruising. I'm looking at my patient's AP diameter. How does that look? And then I can listen to my patient's lung sounds. Now, I do want to make note that because my patient's laying down, and you don't have to verbalize this in your final, but I do want to say it, I'm not going to do my posterior lung sounds right away. I'm going to do those closer to the end because I know I'm going to have my patient get out of bed and walk so I can assess their musculoskeletal system. And when my patient sits up, that's going to be the best time to do those posterior lung sounds. So I'm really trying to minimize my patient's up and down movement. I don't need her to get up and down and up and down, so I'm just going to defer the posterior lung sounds until I can kind of clump them together. So you can listen with your earpieces pointing away from you. And I want you to listen to 3 specific spots on the anterior thorax. And so that'll be 6 total, 4 laterally, so that'll be 8 total, and then 5 posteriorly, which is 10 total. So I can either feel for my patient's clavicle and listen. If you have a patient who has large breasts, it's going to be harder to listen to those 3 landmarks, so you can listen above the clavicle. But if you have a male, or if you're able to listen to a good portion of that anterior chest, it doesn't really matter if you go above and below, if that makes sense. So I'm just going to feel for your clavicle, and I'm going to listen for a full inspiration and expiration. I'm going to do the same thing bilaterally. So this is landmark 1. So you see here how I did my 2 below the clavicle. If you wanted to, you could do 1, 2. Okay, you can hear the breath sounds either way. And then my 3rd one is going to be under here. So if you have a patient with breasts, you just say, I'm just going to take my hand and lift your breast here so I can listen to your breath sounds under your rib cage here. And then you can do the same bilaterally. Very good. And if it's okay, Jane, I'm just going to have you put your hands above your head, and I'm just going to listen to your lung sounds on the side here, okay? And when you do these 4, just kind of go in a zigzag pattern. And if at any time you feel like you're getting winded or you're dizzy, just let me know. But you can just breathe normal. Great, and now I'm gonna kind of just work my way down. So, well, actually I'm not done with the thorax yet. Well, you can put your hands down, just relax. I'm actually gonna do the cardiac now. So, I wanna listen. First thing I wanna do is always inspect. We did our carotid artery in our midterm, so we don't need to worry about doing that now. But, what else is part of the neck vessels? Our jugular vein. So I wanna look at the jugular vein and just make sure I don't see any distension. So I wanna get down here and see, I can see that jugular vein pulsating just by visualizing it, and I don't see any distension, which I don't wanna see. So that looks good. And then I'm gonna work my way into auscultating the heart. So again, I'm gonna feel for my clavicle. I'm gonna go down to that second intercostal space. Again, this would be directly on the skin, but for the sake of demonstrating on our partner here, we're doing it on over the clothing. Second intercostal space, this is where I would best hear S2. This is the aortic valve. And then I would go over to the pulmonic valve, which is also the second intercostal space. This is also the base of the heart where you can best hear S2. And then I would work my way down to the third intercostal space, which is Erb's point. This is where you can best usually hear heart murmur. So if I felt like I heard a heart murmur here, I could turn my stethoscope over and use the bell of my stethoscope. Then I'm going to work my way down to the fifth intercostal space where I can best hear that tricuspid valve. I'm going to listen here. And then I'm going to work my way over also to the fifth intercostal space where you can best hear the apical pulse, and this is also the mitral valve. This is the apex of the heart where S1 is best heard. For that apical pulse, you want to make sure that you listen for a full 60 seconds to that heart. All right, so next I want to work my way down to the abdomen. At this point, I would expose my patient's abdomen. I would get a really good inspection. What is the contour of my patient's abdomen? Do I notice any lesions, any scarring, any striae, bumps, masses, bruises, anything like that just by looking? I might also kind of get down and see if I can see that aortic pulsation there. Ask about any scarring if I see any. And then I'm going to go right into auscultation. So whichever quadrant I start with, I'm going to work my way in a clockwise fashion. And I would listen to 3 distinct, and you don't have to listen for the full whatever minutes, but just verbalize. I would listen to 3 distinct areas within each quadrant, working my way in a clockwise fashion. Listening to whether my patient has active, hypo, or hyper active but bowel sounds. Then I also want to listen to my patient's arteries to make sure that I don't hear any bruit. So I would listen to the aorta. I would listen to my patient's renal arteries bilaterally. I would listen to my patient's inguinal arteries bilaterally, and my patient's femoral, making sure I don't hear any bruit. So once I listen and auscultate, now I can go into a light palpation and a deep palpation, also in each quadrant, working in a clockwise fashion. So With the light palpation, I would just start very lightly, and you can just kind of verbalize, you know, working through this and what you're looking for. And I'm really just going and feeling for any kind of masses, asking the patient if there's any tenderness. And that light is really just kind of feeling that subcutaneous fat, feeling the skin, and again looking for tenderness or any masses. And then I would go into a much deeper palpation, feeling the patient's muscle, the organs, and again looking for those same things. Any masses, any tenderness when I do that. So, moving on, at this point, I'm kind of doing a peripheral assessment now. And I want to look at my patient's legs. I'm also looking for varicose veins. I'm looking for edema. Another thing when I walked into my patient's room that I automatically look for is just a generalized edema. And so I didn't notice any on my patient's upper extremities, but most of the time, if they do have edema, you're going to see it in their legs. And so I'm definitely paying attention to that too right now when I'm looking at my patient's legs. Looking for any bruising, any wounds. I'm looking at my patient's feet. I'm also feeling the temperature of my patient's legs and feet. Lets me know about their circulation. And then I can kind of come down here and I would go right here and feel for my patient's dorsal pedis pulses or the post-tibial pulses. One or the other, it doesn't matter as long as you verbalize one or the other. And then you're grading that on a +2 scale. While I'm down here, I remembered that I also wanted to check my patient's radial pulses. So because I remembered that when I was doing my patient's pedal pulses, I could come up here and just, oh yeah, I wanted to check and see what your radial pulses are. And then I would grade those on a scale, and yours are +2, nice expected finding. I would also grade my pulses down here on a +2 scale. They're a +2, it's good. I would look for edema, also grading that on a scale. I don't see any edema, so that's good. That's a 0. So everything looks good there. Okay. I can, let's see, what did I forget? I'm just going through, and it's okay if you do this, you know, it's talk to yourself through the final. Did I forget anything? All right. So, Jean, if it's okay with you, I'd like to just kind of take a look and see how steady you are on your feet. Kind of look at your nervous system a little bit too, if you're okay with that. So what I'd like you to do is, could you just stand up and just kind of walk over here? I'd like to see you turn around and then walk back to your bed, if that's okay. All right, great. And so while she's doing that, I'm simultaneously assessing her musculoskeletal system and her nervous system. How is her balance? Is she distributing her weight evenly? Looking at all that. I'm also looking at her range of motion. She's moving her hips, she's moving her lower extremities. Even with her stride, she's moving her upper extremities. Okay, so Jean, would you do me a favor and put your heels of your feet together and just close your eyes? Okay, so I'm looking at her balance. Is she able to stand there nice and still when she does that? Great. That looks great. So what I'm going to have you do now, Jean, if you don't mind, I'm going to have you just kind of sit on the edge of this bed, dangle your feet there, and I'm going to test a couple of other things, okay? I want you to be able to tell me a couple different things, but before I do that, I want to show you that this is sharp, okay? And this is dull. So what I'd like you to do is in a second I'm going to ask you to close your eyes, and I want you to tell me if you feel sharp or dull and where you feel that, okay? So go ahead and close your eyes.
Sharp on my right thigh.
Great.
Dull on my right knee. Sharp on my left calf. Dull on my left ankle.
Wonderful. Okay, so now I'm going to have you do the same thing, but I want you to tell me where you feel this. This is soft, okay? So go ahead and close your eyes.
Right hand.
Okay.
my right finger.
Great. And then, you know, obviously in the real hospital setting, I love that.
Left ankle.
Okay. Your patient is going to have clothes on, and so I would do a lot more in the upper extremities too, where their skin is. But again, for the sake of this demonstration, I'm just working with what I got here. Great, you passed the test, Jane. Now what I'd like to do is I'd like to check a couple of your reflexes. So in your final, you're just going to do one upper, one lower. It doesn't matter to me which one you choose. Just so you do one upper extremity, one lower extremity. So I'm just going to kind of feel for your tendon here. Yep, so I saw that. Nice, good reflex. Call that a +2, and so I could do that, or I could have her kind of relax, you're nice and relaxed, nice +2 there, and then I'll just do one in both your knees here. Okay, nice +2. Yeah, that was a good one. Nice +2 there as well. Okay, so what else do I want to do? Did my reflexes, my pulses, peripheral, motor, sensory. Motor I did at the same time, you know, when she walked. Sensory, did the touch. Did my edema, my pulses, abdominal, respiratory, cardiac. I could do strength. So can you go ahead and squeeze and then pull down on, see how strong you are. Good. It's a nice +2 strength in the upper extremities. I'm going to have you uncross your legs, and I want you to push against my hand as hard as you can. Very good. How about here? And push against my hand, push against my hand. Great. Good +2 strength in my lower extremities. So we also checked range of motion when she walked, but if I had any concerns about any specific joint, I could isolate that joint and have her do, you know, like circumduction or different kinds of range of motion. But even just watching her walk back and forth in the room, looking at her gait, her steady, I'm not concerned about any of the range of motion or anything like that. I also did a very detailed health history on her where I talked about her musculoskeletal system and all the different systems, and she told me that she doesn't have any concerns, and I agree with her. So while she's sitting up here, I'm going to come back in the back and finish off my respiratory and thorax assessment. So while I'm back here, I'm getting a good look at her skin back here, especially important if they've been in the hospital and laying down for a long time. I'm even looking at the back of her head to make sure she doesn't have any ulcers there. Getting a really good look at that skin integrity, making sure that I don't have any concerns about her skin integrity. And again, while I'm back here, I'm also looking at that AP diameter, okay? So you're gonna feel the stethoscope kind of hit your back. When you feel me, release it and put it on a new spot. I just want you to take a nice deep breath for me. But again, if at any time you get dizzy or you need to just take a break, that's totally fine, okay? So I'm listening in 5 spots for the full inspiration and expiration. Always listening bilaterally. Okay, great. Everything looks great. All right, Jane, I'm excited that you get to go home today. Everything looks good for me. And then at this point, it would be a good opportunity to, do some promotion, ask more questions as I work through my assessment. I'd be simultaneously doing subjective data collection, but overall, everything looks great. So